Good afternoon, everyone. This is Andy, better known as Cancer Geek. And on today's episode, what I want to do is actually share a story that was shared with me yesterday evening in response to the video clip that's entitled Flipping Physician Burnout. And so one of my physician colleagues and friends shared with me their personal story on how they make sure on a daily basis that they fulfill their why. And it was a great story because it actually coincides with my philosophy on the fact that care delivery happens at the N of 1. And so this radiologist shared with me that, yes, they're measured on relative value units. And so for those of you that don't know what relative value units or RVUs are, it's a measure of the amount of work that you do. And so the more complex, in this case an imaging exam is, the higher the RVUs. But what this radiologist shared with me is that when they go about their work, they really think about it in terms of delivering care at the N of 1 and trying to make a profound impact in the lives of a patient. And the way that they go about doing this is that as the referring order comes in from the physician, they read it, but then they go ahead and they start to read what the referring physician's notes were so that they can understand clinically what was going on and really get at the root of what is the clinical question that needs to be answered. In addition to that, they open up the patient's chart, they look at past medical histories, they look at previous imaging exams so that they can get a full picture of that patient to the best of their ability based on what's residing within the patient's chart. And as they start to put this picture together, what it allows them to do is understand what is the story of that specific patient, so that as they're going through the exam, they can take all of this information and put it together and begin to not only give a definitive diagnosis, but to answer the best question for the right patient at the right time. Because what they understand is that the words that they use are going to formulate and shape that patient's world, and it really determines and establishes the journey that that patient is going to continue to take inside of medicine. And I thought it was a profound example of how radiologists can take back some of their power and leverage the system of healthcare to fulfill their why, which is really the practice of medicine. The practice of medicine that happens at delivering care at the N of 1, which ultimately means that they're impacting the lives of people and the patients that they become within their communities. And so for all of us out there, I think it's a good reminder that no matter what happens on a daily basis, care happens on a personal level. It happens at what I like to call the N of 1. So as you go forth with the rest of your day, remember that when you're delivering medicine, care, and you're looking after the patients that you're responsible for, it always happens at the N of 1. Have a wonderful weekend.